Retain labs, changing the game for healthcare professionals. Up to 1 in 5 babies need help to breathe at birth, which we call neonatal resuscitation. Now, neonatal resuscitation is extremely stressful. And when you perform neonatal resuscitation, it can result to distraction, decision-making deficiencies, impaired working memory, deviation from the resuscitation algorithm, or even worse, medical errors, poor patient outcome, or fatal errors and death. Most important, that up to 66% of newborn deaths during neonatal resuscitation are caused by breakdown in non-technical skills like decision-making, communication, and teamwork, and not technical skills like mask ventilation or chest compression. Now, what are the existing training options? Well, the existing training options, they focus on technical skills, they're resource intensive, they're time consuming, and generally require simulation specialists, so people who are trained in providing simulation to healthcare professionals. They're resource intensive. Simulation centers can cost a lot of money to start them up. There's limited space and funding for equipment often available. They also have annual maintenance fees which are high. And you have to include salary for simulation specialists. They're time consuming. You need to schedule the staff, you need setup time, and you need administration time. What's our solution? Our solution is Retain, the resuscitation training for healthcare professionals, which was developed by multidisciplinary teams of neonatologists, designers, healthcare providers, computer scientists, and educational psychologists. The mission is to improve training of healthcare professionals to reduce errors and improve the lives of newborn babies and their families. The goals of Retain are medical error rates during neonatal resuscitation are reported to be between 16 and 55%. Most fatal errors or medical errors which can result in poor patient outcomes are due to non-technical skills like decision making, communication, and teamwork, and not mask ventilation or chest compression. The Retain tabletop or digital simulator strengthens and focuses on these non-technical skills. The Retain tabletop simulator is an effective and efficient alternative to train non-technical skills. It can be self-directed or facilitator directed and includes 50 evidence-based scenarios, has low costs, and is accessible anytime and anywhere. Now, if you buy the Retain box, what do you get? You get a game board along with all equipment and cards needed to perform neonatal resuscitation in a playful but serious way to improve non-technical skills. On the other hand, the Retain digital simulator is an effective and efficient approach to train the algorithm and retain the knowledge. It is self-directed. Facilitators can send test scenarios to healthcare professionals to assess the current knowledge and training needs, and there are over 200 evidence-based scenarios with various difficulties at low cost and accessible anytime and anywhere. Within the digital simulator, you would check the medical history, you set up your equipment, and then provide resuscitation care according to the patient needs. Has sound effects as well as a deep breath at the end. Now, how can Retain fit within your environment? First of all, Retain does not replace skill training like chest compression or mask ventilation. It is there to train non-technical skills, as they are responsible for most medical errors. You can do virtual immersion and use Retain via telehealth or video conferencing tools and focus training sessions on your health professional needs. You can do just-in-time training. So basically, just before you go to delivery, you can practice what potentially you can expect at that delivery. So you could prepare for the birth of that baby. And you can bridge in between your skilled training session. Healthcare providers have to be recertified only once every 2 years. And research has shown that knowledge significantly decays within 3 months after training. Here, Retain would be a perfect bridge for in between those recertification sessions. Now, Retain has been supported by several studies who showed the effectiveness of Retain compared to traditional training programs. Overall, 95% of healthcare professionals who played Retain thought it is useful for training. There was a knowledge improvement by 36% after one Retain training session. Knowledge retention remained by 100% after 2 and 5 months after the initial training session. Just remember, knowledge decay occurs around 3 months after traditional simulation training. And it can be used in assessment as an assessment tool and focus on individual weakness of healthcare providers. What's the anticipated impact of Retain? Well, there's 1 million newborn babies who need resuscitation die every year around the world. If we consider 66% of these deaths are related to deficiencies in knowledge and communication, Retain has the ability and possibility to improve the lives of many newborn babies by safely and correctly provide resuscitation care, and therefore can save many babies around the world. Please use the links if you're interested in purchasing the Retain simulator and help our mission to making babies better in your community, because everyone deserves the best start to life. And through Retain, we hope to transfer the future of communities around the world by improving care for babies at birth.